Hi, this is Dr. Vijayaraghavan, a consultant spine surgeon at MGM Healthcare. Today I would like to talk about some of the common myths people have regarding spine surgery. So whenever we advise spine surgery to a patient, they normally come up with these two questions frequently. Number one, do I have to take prolonged bed rest after spine surgery, and how much time will I take to get back to my routine work? Second question, how much is the risk of paralysis and is it safe for me to undergo this complicated procedure? So addressing the first question, prolonged bed rest after spine surgery, is it really required? No, definitely not. Most of the time, patients do not require prolonged bed rest after spine surgery. In fact, the reverse is true. If a person is bedridden due to a spine pathology, actually a spine surgery can help him or her to get out of bed and walk as early as possible. So from where does this concept of prolonged bed rest came? In olden days, when even MRI was not in practice, most of the spine ailments were treated by prolonged bed rest and spinal traction. But after the advent of MRI and other investigative modalities, most of the spine pathologies are better understood by spine surgeons, and even the treatment procedures have seen a revolutionary change in the past few years. So now coming back to the question, when can a patient actually walk after a spine surgery? So mostly the spine surgery is performed for lumbar disc herniations or cervical disc herniations, lumbar spinal stenosis, or even a spine fracture without a neurological deficit. The patients are made to walk the next day after spine surgery. With the use of minimally invasive spine surgeries like keyhole spine surgeries, the recovery rate is even more faster. The patients are made to walk on the same day and they have a shorter hospital stay and they return to work in less than a week, whereas in open spine surgery, it may take 2 to 3 weeks. So now coming back to the second question, the risk of paralysis. Yes, there is theoretically incidence of 0.5 to 1% incidence of neurological injury in a complicated spine surgery. This is almost equal to the number of road traffic accidents that we see in our country. But still, we never think about RTA when we are traveling on road. Similarly, when it comes to spine surgery, a person need not always have to think about a neurological injury because the incidence is very low. And further, we do have some recent modalities and tools like neuromonitoring and navigation to make spine surgery even more safer. So what is neuromonitoring, and how and when a spine surgeon actually can diagnose or identify a neural injury? It is only after the spine surgery, when the patient comes out of anesthesia, when he or she wakes up, we spine surgeon examine the patient and look for movements of their limbs. If they have a muscle weakness, then it indirectly implies that probably he or she may have had a neural injury during spine surgery. So is there any way for a spine surgeon to identify this neural injury during the surgery so that he can reverse it? Yes, there is a modality, and that is what exactly neuromonitoring does. So in neuromonitoring, we have small electrodes which are connected to the muscles of the patient who is under anesthesia. The other end of electrode is connected to a computer monitor, and a normal functioning muscle activity is reflected in the waveform in the computer monitor screen. So similarly, it's similar to your ECG waves that gives an idea about your cardiac activity. A properly trained neurophysician will continuously watch these waveforms when the surgeon is performing the spine surgery. So even when there is a minor insult to your neural tissue, there will be alteration in these waveforms, and this neurotechnician can alert the spine surgeon regarding the change. So this gives us an opportunity to correct the neural injury that could have occurred during the spine surgery, rather than after the surgery. In literature, there is enough evidence to prove that neuromonitoring has decreased the incidence of neural injury in complex spine surgery. Now, coming to the other tool, navigation. Navigation is somewhat similar to Google Maps that we use when we drive our cars. So a driver can actually see where exactly the car is moving in the navigation screen. Similarly, in navigated spine surgery, we spine surgeons can actually get a three-dimensional picture of the spine as well as the instruments we use in a big screen. So this helps us to be more precise when we do our spine work, and every millimeter movement of our instruments inside the spine can be watched live in front of us inside the operation theatre. So this reduces the margin of error. So more precise the work, less will be the neural injury. So we here at MGM Healthcare offer a combination of both neuromonitoring and navigated spine surgery for patients in case of complex spine surgeries. Thank you for listening. Hope this video will help people to break the myths and get the real facts about spine surgery. Thank you.